Hello everyone. The information about COVID-19 will be translated from English to South African Sign Language.
Coronaviruses can cause mild to severe diseases, flu-like symptoms. For example, in the past, MERS and SARS. In 2019, the coronavirus was discovered where? In Wuhan, China. They discovered it in December 2019 and it was named COVID-19. The World Health Organization works closely with world experts, scientists, governments and partners to rapidly expand scientific knowledge on the COVID virus because much still needs to be done and researched. So, now it's important that I give you advice on how to protect yourself and the spread of the outbreak. How is the disease transmitted? Firstly, person-to-person contact, likely to spread through respiratory droplets when you cough. So those tiny little droplets then come in through your respiratory system. And that's why you need to be at least 2 meters away from someone when you are in a social environment. It also spreads through touching contaminated surfaces. So what are the symptoms of COVID-19? Well, they include the common symptoms, but also severe symptoms. What are the common symptoms? Sore throat, coughing, headaches, quite bad headaches actually. And then the severe symptoms are a high fever, when you start feeling hot and cold, shortness of breath, panting and shortness of breath, and then of course severe respiratory diseases in the nose, the throat and the lungs.
Workers at risk of infection. Although everyone may be at risk of exposure to COVID-19, the risk is higher for workers interacting with persons that may be infected. Immunocompromised workers are at higher risk of infection. These are people who have got asthma, diabetes, or heart disease. Higher risk exposure group workers include airline operators, border control, health workers, laboratory workers, pathologists workers, funeral services workers, solid waste and water waste management workers. Identifying potential sources. Identifying exposure risk for workers and implement appropriate control measures. Consider if their workers were in contact with COVID-19 suspect while on duty. Determine if workers could be exposed to areas contaminated with the virus. Identify sick individuals and screen for signs and symptoms or history of their travel to COVID-19 affected areas.
So, do you suspect that you've been exposed to COVID-19? And if so, what do you do? First of all, alert your supervisor or the occupational health clinic. Tell them immediately. Look after yourself and inform a doctor if you're experiencing any of the symptoms. Sore throat, coughing, chest pains, inform them because that's very important. Tell them if you've met someone recently who's travelled and if you've been in contact with someone.
If your healthcare provider suspects that you may have COVID-19, then a laboratory test would be required. The National Institute for Communicable Disease should be contacted for further information. The NICD's website is www.nicd.ac.za. This provides detailed information and guidelines on how to collect and transport clinical specimens from patients under investigation to the laboratory, or contact them on their hotline number, which is 080-002-9999, or their other number is 082-883-9920.
So, what are the workers' responsibilities? W. Wash your hands regularly using soap and water for at least 20 seconds. Or use a hand rub which is alcohol based of at least 70% or above. O. Obey the health and safety policies and procedures. R. Remember to cover your nose and mouth with a flexed elbow and tissue when coughing and sneezing, and throw the tissue away. K. It is key and important to avoid exposure and also refrain from exposing others to potential risk. E. Ensure you don, doff and dispose of personal protective equipment properly. R. Report any situation that is likely to present a potential or serious danger to your life or health. S. Self-monitor for signs of illness and self-isolate or report your illness to managers if it occurs.
Workers' rights. Workers' rights include that employers and managers do the following. Ensure that all preventative and protective measures are taken to minimize risk, including provision of adequate PPE supplies. Provide continuous awareness, education, and training of workers on anticipated occupational exposure to COVID-19. Create a culture whereby workers can report freely without being stigmatized. Advise and encourage workers on self-assessment, symptoms reporting, and staying home when ill. Allow workers to exercise the right to withdraw from work activities that they have reasonable justification to believe present a serious danger to their life and health. Report to the Compensation Commissioner if work-related. Prevention and control of workplace exposure to COVID-19. A risk assessment should be conducted in the workplace to determine the risk of exposure to COVID-19 and communicated to workers. Administrative controls. Every employer must have a workplace plan of action in place for readiness. The occupational health and infection control personnel should establish points of contact between the organization, personnel, and local health facility. Workers potentially infected with COVID-19 must be isolated immediately. Restrict number of personnel entering isolation areas with COVID-19 cases. Established public health reporting procedures should be swiftly followed.
Personal protective equipment. Limit the spread of infectious respiratory secretions by always wearing a face mask. Personnel must wear protective gloves for patient caring and cleaning contaminated surfaces. Respirators, e.g. N95, are only for aerosol generating procedures like nebulizers, unless informed otherwise by the WHO. This is important that we follow that recommendation. Contact and droplet precautions include wearing clean protective clothing to make sure we avoid contamination. Environmental and engineering controls. Isolation rooms are recommended for COVID-19. For example, healthcare facilities have isolation rooms in each of them. Airborne precautions should apply for high-risk procedures, for example, nebulizing and the process of suctioning. Alcohol-based solutions, for example 70% ethanol, must be used when we decontaminate surfaces. Avoid the use of compressed air or water sprays to clean potentially contaminated surfaces, as these may aerolize infectious materials. Surface cleaning devices are recommended. For example, the UVGR, that's the purple light that shines on surfaces, that is recommended.